According to WHO, Nigeria spends less than $15 per person on health each year. South Africa spends $250. The United Kingdom spends thousands. Even neighboring countries spend more. And of the little money released, much never reaches the front line.
Imagine I went to a government hospital and I was paying heavily as if I was paying I was in a private hospital.
Nigeria in 2001 pledged, along with all African Union countries, to target 15% of its annual budget for healthcare, the so-called Abuja Declaration. But 18 years later, Nigeria's highest ever budget share for health was just 7%.
Every year, Nigeria's government allocates billions of naira to public health. And every year, hospitals run out of gloves, pregnant women buy their own gauze, and patients die from conditions that cost almost nothing to treat. This is Vital Science Unfiltered. Today, we are following the money through the budget, the bureaucracy, and the gaps where it disappears. In 2001, African Union countries, including Nigeria, signed the Abuja Declaration. The promise was simple: at least 15% of the national budget would go to healthcare. More than 2 decades later, Nigeria has rarely come close. Most years, the healthcare spending itself sits around 4 to 6%. According to WHO, Nigeria spends less than $15 per person on health each year. South Africa spends $250. The United Kingdom spends thousands. Even neighboring countries spend more. And of the little money released, much never reaches the front line. Hospitals report missing supplies, ghost equipment contracts, and rural clinics where the budget on paper doesn't match the empty shelves on the wall. Audit reports have repeatedly flagged billions in unaccounted spending. This is what economists call leakage. Money allocated, money disbursed, and money that simply vanishes between government and the patient's bedside. The result? Ordinary Nigerians fund their own healthcare. More than 70% of healthcare spending in Nigeria comes directly out of pocket. Families sell land, borrow money, crowdfund online. One hospital admission can erase decades of savings, and when families can't pay, they don't go. And preventable illnesses become preventable deaths, because public health is not just a budget line, it is a promise. And in Nigeria, that promise has been broken quietly for decades. This is Vital Science Podcast, and sometimes the most expensive things in healthcare isn't the treatment, it is the bills no one ever audits. Thank you.
If you've enjoyed this episode of Vital Science Podcast, kindly like, share, comment, subscribe, and don't forget to turn on your post notification button. Thank you.